Good afternoon, speech class. Fibromyalgia is among the invisible disease syndromes. I say invisible because there are no outward visible signs of the disease. According to Sarah Ryan in her 2011 article, Fibromyalgia, an overview and compare of treatments and of treatment options in the British Journal of Nursing, 2 to 5% of the population, mostly women, are affected. I know this firsthand because I was diagnosed in August of 2011. I will be sharing with you how it is diagnosed and treated and how it affects the quality of life, especially my own. A possible key factor in the cause can be emotional trauma. By the time I was diagnosed with fibromyalgia, my mother, my stepfather, and my grandmother had passed away in a matter of 3 years. And in the past year, I have experienced 2 deaths in my family, my stepmother and my sister-in-law. Secondly, abnormalities in the central pain processing could be the cause. In other words, a fibromyalgia patient will have increased pain perception or hyperglycemia, or pain to stimuli that are not normally painful, such as touch or alania. Another symptom is lack of restorative sleep. A fibromyalgia patient will have a lack of deep level sleep, which will cause fatigue. The process of diagnosing fibromyalgia consists of identifying 11 to 18 tender points. And tender points are a specific point that triggers a response of extreme pain when pressure is applied. These tender points are bilateral, meaning both sides of the body, and they are as follows: the front neck area, the front chest area, the back of the neck, and your back shoulder, and your shoulder blade area, and your elbows, and your lower back, which I have a lot of trouble with, and your rear hip, and your knee. And sometimes it goes all the way down to my feet. So it's just like from head to toe, you've got this chronic pain. And sleep disorders mentioned in a patient's history due to the pain, and which it causes chronic fatigue experienced by fibro patients. And a fibromyalgia patient will have cognitive disorders, and these are commonly known as fibro fog. And I've experienced this many times. For example, I can be talking about something and I want to say something, but I completely forget what I was going to say. And it won't come back, and it just goes away. Or else I can go to a room after something and I have to stop and think, well, what did I come in here for? And I can't remember. And drug treatment can consist of Cymbalta, which is a serotonin norepinephrine reuptake inhibitor, or SNRIs, or Savella, which is a selective serotonin and norepinephrine dual uptake inhibitor. I personally use the Cymbalta for the depression, and the Savella is effective in that it reduces the pain perception in your brain. Cognitive behavioral therapy along with the drug therapy is also an option, but that is one that I haven't tried as yet. And adequate sleep is also a form of treatment, but it's more the quality of the sleep, not necessarily the quantity. The effect on this disease is like having chronic flu-like symptoms without the fever. You can just ache like you have a fever, but you don't have a fever. And that can in itself can sometimes be debilitating and can be very tiring. And the fatigue from lack of restorative sleep will also affect your day-to-day life. In conclusion, fibromyalgia affects 2 to 5% of the population, but mostly women are affected. Some causes could be emotional trauma, sleep disturbance, and abnormalities in the central pain processing areas of the brain. There is increased pain perception or pain to stimuli not normally painful, such as touch. To make a diagnosis, you have to have 11 of 18 tender points. They must be established in order by a physician, and you could have the sleep disorders and the cognitive symptoms. Treatment can be drug treatment, cognitive behavioral therapy, and adequate quality sleep. The effects on the quality of your life is to be going around feeling like you have the flu all the time. And that in itself can be very tiring. So my own quality of life is affected very much in the ways that I have described to you today. And I do my best to push forward and stay active in both my mind and my body.